Well, good morning, everyone. Once again, welcome to another live this morning. Hope you're having a wonderful start to your day. And we appreciate you guys coming on with us live if you can. Always a lot of fun. And we'll say hello to a few folks if I can get this up here. Let's see if it comes up. Let's see when I get my notifications. Okay. Let's see here. Hello, guys. Okay. So far, nothing. Hello, it's got to be here somewhere. There it is. There it is. Okay. I'm going to say hello to a few folks. Nick from our staff is right up on the top. Bonnie and David, Kate, how are you? Tarana, Marl, Jen, Sandy from Vancouver, Washington, Maria, Anna, Donna, and Rhoda, Diane, Sully, Cheryl, West Virginia, Vince, how are you? Bonnie, Little Britain, Frida, Denise, Lise, how are you? Good morning to you. Jean, how are you? In South River. Arlene, Carol, West Virginia, Sharon, Kansas, Millica, Stouffville, Lorraine. Imagine coming to the end of summer here. My word. Dale, how are you? Francis from Vaughan. Dave from Cardiff. Hi, Janice. How you doing? And Patricia from Windsor. Marianne, how are you? Jean from Peterborough. How about Peterborough? My word. Cindy, Saskatchewan, Maryland, Charlottetown. Donna, Danny, Iron Bridge. How do you like that? Danny Lee. Or Danny Lee. Donna. Another Donna. Catherine. Marla. And Patricia from Florida. How are you? Susan from Florida. How you doing? Marlene. Norma. Darlene from Alberta. Brahim. There. Brahim, I wait on you. Annette. Nice to have you on. Sherry. Oh, I want to sing, Sherry. You have no idea. Arlene and Nativity. Bruno. I'm going to say hello to, wait a minute, Rita. There's lots of Patricias this morning. Mona, Lorraine. I'm going to say hello to Yolande. Rain Cloud. I'm going to say, hi, Nellie. How are you doing? And Brenda. I'm going to say hi to Doc McEwen. I didn't see your name. Bruno. Deb. Sharon from Lakefield. And Dale, how are you from Waterloo? Good morning to you. Another Patricia, but this time from Calgary. Laura Grimsby. John, how are you? Okay, let's get going. There's Fran. Fran, I was waiting on you. I was waiting on you. Karen, Mary, and Trudy. Thanks, guys. Gloria from New York, we love you dearly. Thanks for coming on, guys. Let's get to the questions, okay? So we've had, we got a fair amount of questions here. This is a question about, and wants to remain anonymous. Okay. Lung tissue biopsy, non-small cell carcinoma. Okay. Looking to activate the immune system inhibits cancer growth. Yeah. Get your immune system firing on all cylinders. Okay. Now, I've done a lot of podcasts, so if you want to go back, go at on your smart device and go to our podcast, the Doctors In podcast, okay? And when you do that, you can scroll and look for, I've got several podcasts that I've done on cancer and tumor growth. And just generally, I'm going to give you a couple of ideas, okay, just to refresh. How do you get your immune system going? Well, there's a positive and negative. How do you get it going? Vitamin D, the sun. Nothing gets your T cells. What do you need to fight cancer? You need T cells. Your Navy SEALs. Okay? Your body's Navy SEALs. You need them to fight cancer. You need your natural killer cells. Okay? And those very responsive to vitamin D. If you can get your vitamin D from the sun, even better. But usually with any kind of cancer patient, I've had them on the supplement. And the way to know if it's working, because you don't have to guess, you can test it, get your dehydroxy vitamin D levels checked. Where I, in my practice would shoot for with a patient, in the United States, somewhere between 60 ng/ml to 100 ng/ml. Now, what does that mean in Canadian numbers? Well, you're looking at around 200 for cancer of NMOLL. Ooh, these blood tests. 200, 250. Okay, you got to be around there, for cancer. So you can actually measure this. It's unfortunate that doctors don't know this yet, and don't hold your breath. But if you got cancer, you suspicious of cancer, get your vitamin D levels checked. Okay? And make sure they're optimized for cancer. So that's one. You want to activate the immune system. Now, I want to tell you what'll put your immune system to sleep. Sugar. It'll put your white blood cells, your T cells, your natural killer cells, it'll put it to sleep. So do you want to do that? Of course you don't. So lay off the sugar. Plus, sugar feeds cancer. We've known that since 1928. The Warburg effect. Fermentation. You want to get rid of sugar. The same thing that makes sourdough bread. Fermentation is the similar process that cancer grows. It needs sugar. Okay? It needs sugar. And what else do you do? Well, there's studies on high DHA. What DHA is like a Trojan horse. It comes in because what happens? Okay? You got cancer cells, fermentation, and then if you have a tumor, they're looking for bad lipids. Send in the Trojan horse, the high DHA. What does that do? Well, it's a carpet bomber for tumors. It carpet bombs the tumor. DHA. So what I have you on that? You bet your boots. Eat steak. Don't eat sugar, eat steak. Cancer hates steak. And you read a lot on the internet today and all that all cancers are parasites. There used to be, and it's still something that I always interested me. Every cancer is fungus. It's a yeast. Okay? I've been talking about that for years. But whether it is or not, parasites can't, fungal, so what? Don't feed it. Whether it's parasites, and they talk about ivermectin and all this and fighting, well, I wouldn't be against that. But I'm just telling you, don't feed the bears. Okay? And, there's a lot of studies on curcumin, how good it is to destroy tumors. Okay? Do all of the above. Okay. Let's see. Okay? That was anonymous, so we'll keep that name. Okay, Dean and Bonnie. I am 78 years old. Let me give you a high five. Good for you. My hemoglobin tested a little bit high. My doctor said I should limit my intake of red meat. I'm getting a migraine. They always blame red meat. Now, when your hematocrit gets high, what is that? Well, your red blood cell count is going up. Okay, I think I got another question about that. Yeah, Lynn's asking. So let me answer both of them here, okay? Lynn is saying my hemoglobin is high. And her hematocrit, it's not that high. Okay, but they tested for polycythemia vera. That they're testing you for a blood cancer, where you have too many, your bone marrow making too many red blood cells. They're testing you for that, Lynn. Okay, and it could be they're looking for a gene. More information. Well, if it's polycythemia vera, well, that's a cancer. That's a bone. That's a blood cancer. So let me know, Lynn, and then I can guide you a little bit better. But back to Dean and Bonnie about, I don't know who's got the high blood test, high hemoglobin. Like one of the things when I used to see a lot of red blood cells, I mean, look, it can be a cythemia, cancer, but a lot of times it was just dehydration. Thick blood, thick as molasses. And they weren't getting enough water and electrolytes. But it ain't red meat. Ooh. And it looks like Dean and Bonnie, like again, who's who here? Your A1C has gone down. Good for you. You're eating properly. Fasting glucose has gone down. Good for you. You've been following the reset for 3 months. You're a smart person. Or persons. Okay? The reset's so good for you. Yeah, it ain't red meat. Okay? It ain't red meat. They always vilify red meat. Because doctors don't know anything about nutrition. Did you hear in the States that they're talking now about all medical schools are going to have to teach nutrition? Boy, I wonder if they're going to hire me. I think there'll be a lot of jobs available. They're going to start teaching nutrition. It's going to be mandatory. Hallelujah. Now, here's where I'm a little bit negative about that. What are they going to teach them? The same thing that dietitians are taught? They drink the Kool-Aid, the pyramid, the plant kingdom first, animal kingdom, very little. If they teach that, listen, even go back into the 1970s. When I studied nutrition, they were teaching me the opposite of what is true back then. They're still teaching that. You have to sort of filter that out. I did. I knew they were wrong even when I was in school. You know why? Because my dad showed me. My dad showed me through diabetes. And that the animal kingdom was the superior kingdom. So I always had that in my craw. But, you have to pass. You have to get your... I didn't want to fight with the professors. I just passed, and I knew that what they were teaching, a lot of it at least, was not right. Anywho, okay. Martin, why do you drink? What is the benefit, or why, of drinking extremely sweet liquid, glucose, before taking a blood sugar test? Well, they want to test what they call glucose tolerance. They give you a cup of sugar water, you drink it, and they want to see what happens to your blood sugar, how high it goes. And so it's a glucose tolerance test, right? And you can have fasting glucose testing. A lot of times they do that. But a glucose tolerance test, a GTT, okay? It's letting the physician know how you tolerate sugar. Now, none of us tolerate sugar very well, but some better than others, right? But that's what they're doing. That's the advantage of it, okay? And remember too, Martin, they use glucose before you get in a PET scan. PET scan technology it's not only for cancer, but it's mostly for cancers. Because if you have cancer anywhere between your brain to your toes, and you take glucose and they put you in a PET scan, you're going to light up like a Christmas tree if you have cancer. Sugar goes right to the tumor. Hello? Hello? And yet they'll vilify, like, okay, you're going to go get a PET scan. Okay? A PET scan. Imaging for cancer. Did they give you a piece of steak and then put you in the scan? Why don't they use steak? No, they use sugar. Why? Think about that just for a minute. Common sense, just for a minute. Yet, every guru just about that I know, every prof in nutrition that I know, and I've been a prof in nutrition, but I always ask them this question. I've always asked them this question. If a PET scan requires you to drink glucose before the imaging, not steak, well, what feeds cancer? Steak or glucose? See how upside down we are? How crazy we are? And for a physician, for anyone to tell you to avoid red meat, they don't know what they're talking about. They really don't. That's religion, my friend. It's religion. It's not true. Cancer hates steak. It hates it. Why? Because it can't feed on it. It hates it. Where have you heard that before? Right here. And I'm doubling down on it. I mean it. Okay. That was Martin. And Lise, what do you think about medical Botox treatment for migraines? Look, I don't know how to answer that in a way, okay? Because when you suffer from migraines, the problem with Botox, there's a boatload of side effects with Botox treatments. Possible. Boatload. And I found, okay, that people that had Botox treatments for migraines, temporary relief. It's like a Band-Aid because it doesn't fix the problem. It doesn't, I took Botox and then I never had another migraine. Here's what I found in my office, okay? Because I always go to what I found in all my years. Migraines, okay? Here's what I found. Generally, always exceptions, but generally here's what I found in my office, okay? Dehydration, almost invariably. They were dehydrated. They had blood as thick as molasses, okay? Migraines. Hormones, in women, hormones. Way too much estrogen, not enough progesterone, and usually high levels of cortisol, okay? They were low in magnesium. Almost invariably, they were low in magnesium. Relax. Magnesium. They were low in it. They were low in B12. You knew I was going to say that. But they were. So I fixed all that. A lot of times they had a gummed up liver in migraines. I emptied it with the reset. And guys, I'll tell you something. Just generally, I got tremendous results with my protocol, with migraines. Okay? And so, Botox, hey, I'm not telling you not to do it. But I saw a lot of patients who had Botox treatments and then came to see me. I usually was the last guy people would come and see. I wasn't the first. I was the last. Generally, not always. Okay? People came to me when they were desperate. I had a lot of that in my office. And people traveled from all over the world. Desperate. Okay. Thank you. Marissa, you want to discuss cellulite. No fun under the sun, is it? Okay. Look, in terms of a supplement for cellulite, the best that I've ever seen is when you combine Navitol because it opens up blood vessels, pine bark extract. And by the way, there was a new study I just read yesterday or the day before. I got to bring this to you on something that I discovered over 30 years ago. And pine bark and fibromyalgia. Study on pine bark and fibromyalgia. Very effective. Yeah, well, that's what I found. I actually wrote a book about it. Okay? Now, I like that pine bark extract. You guys know me. I talk about it all the time. I love it. I love it. I love it. Because it is something that it's like a flagship product for me is pine bark extract. So cellulite, okay? And there's no magic. Okay? There's no magic. Cellulite, from a natural perspective, okay? Bone broth, collagen, elevate that, okay? Collagen for cellulite. And the best collagen is bone broth collagen. And I've got tens of thousands of people that use that on a daily basis. Tens of thousands. And they love it. And I love it too. And it's good for you. And if anything's going to help with cellulite, I'd have bone broth and Navitol and put them together. Okay? Internally. Look, I know there's gels out there, guys. I don't know. I never saw anything that dramatic. You know, I know they do skin treatments with laser and stuff like that. I don't know. You tell me if women found that effective for cellulite. Maybe. Okay? Maybe. But I know what I did. Okay. Thanks, Marissa. Tammy. I am Tammy from Texas. Well, hi, Tammy from Texas. I love you too. I have a question about peptides. My son is in the medical field and he's all about peptides. Well, I like peptides. I like protein. I like peptides. I like amino acids. I know there's a big thing on peptides. The best is bone broth. I still tell you, there's nothing like it. Okay? And like to heal joints, weight loss and everything about them, I don't know. I like it. Okay? I got no problem. But, you know, is it the cure all and end all of everything? Nah. It's good though. Okay, I like peptides. And protein peptides and you know, like there's powders you get for peptides. And look, again, I'm a bone broth guy. I am a collagen guy. And I know there's treatments with peptides. I don't know. I'm not saying I'm totally convinced, but I'm not against it. Okay? I got to do a program on that. I think that's what I'll do. Sharon, is hypoglycemia insulin resistance? Yes, in a way it is. Hypo is different than hyperglycemia, but a lot of people suffer from hypoglycemia, and it's an insulin problem too. It is resistance to insulin. And remember this, okay? What goes up in terms of blood sugar must come down. And a lot of people, because they get that fluctuation, and with hypoglycemia, I never had them just, you know, grabbing sugar or whatever. I used to get them eating much more protein. And if they really suffer from hypoglycemia, they might have to eat more frequently until they fix it. But the key is the choice of foods. And it's protein with hypoglycemia. Okay? And usually what a hypoglycemic patient will reach for is something to break down quickly to bring their blood sugar back up. But then now it's going to fluctuate more. So I always had my hypoglycemic patients. They couldn't fast in the morning. They had to get up and eat. Okay? And that's all right if you eat the right things. Lots of people can't fast. Okay? Diabetics, they have trouble fasting. I'm not saying they can't. I'm just saying a lot of them have trouble, especially when their blood sugars are subject to fluctuation. So for me, I was big, get up and have bacon and eggs in the morning and leave the toast alone. Sausage and eggs too. Okay, somebody asked me that the other day. You always say bacon and eggs. Okay. Yeah, Sharon, listen, it's hypoglycemia is a big, insulin, big time involved. Brahim, is it true red meat causes issue with the prostate? And Brahim, you know what I'm going to say. You know what I'm going to say. They always blame red meat. Prostate grows 2 ways. How does your prostate grow? 2 ways. Insulin, that's sugar, not steak. Okay? And estrogen. A man's prostate grows because estrogen has gone up and testosterone has gone down. That's why men get BPH, benign hyperplasia. Okay? Their prostate grows. It needs insulin and it needs estrogen. It's like PCOS in a woman. How does a woman get polycystic ovarian disorder? How do they get that? Too much estrogen, they're too much of a woman, and they get too much insulin. That's why a lot of doctors give them a treatment to get their insulin down, and that they use metformin. That's a Band-Aid. Eat the right foods. But Brahim, you know I was going to say that. Okay, what are you saying? I got BPH, yeah, joined the cast up, and your PSA was 8, it was elevated. You had a biopsy. BPH can cause higher PSA. Yeah, but listen, let me give you a little bit on PSA, okay? PSA tests for men, for their prostate, okay? It's an antigen. And what it is, it was never meant for cancer. But doctors used it for cancer for years, and they still do. But your PSA goes up. All it means is your prostate is big. Got a big prostate. And when you lower it with you lower your insulin and you lower your estrogen. That's why I have a lot of men on DIM. They're eating flax seeds. I even have them on the menopausal formula. Isn't that for women? Well, it helps women, but it helps men too. It lowers their estrogen. Men have big trouble with estrogen. Big time. And remember, we live in an estrogen-dominated world. Everything from plastic to air fresheners to pesticides and herbicides. You ain't getting away from it. You ain't. But you can lower it by dimming out your estrogen. Okay? Dim it out. Block it. The best way you can. Okay. Thank you, Brahim. You already knew Brahim, come on, be honest. You knew the answer. Red meat is good for your prostate. Ooh. And Brandon says, how do we get PSA numbers down? Well, there you go. I already answered, Brandon. Okay? You and Brahim were on the same page this morning. Dim it out. Get your insulin down. Insulin is a growth hormone. So is estrogen, Brandon. Okay, Carrie. Asking for my mom. Her legs feel heavy and tend to be swollen. Her blood work was all normal. Told to wear compression socks. She will have heart and veins checked. What would you recommend? Yeah, I like compression socks. Okay? A lot of times, with heaviness in the legs, okay, it can be microcirculation. That's why I would have her on Carrie. I'd have her on Navital. I'd have her on the pine bark extract, those little capillaries in the legs. That's what you get that heaviness feeling. It's the capillaries, the little attachments between your arteries and veins. Okay? And that really makes a difference. Sometimes I found that with heaviness of legs, just not always, they were anemic to some extent. They were low in B12 and iron. Okay, so eat more steak. Thanks, Carrie. I appreciate it. Jocelyn, I'm a kinesiologist. Okay, well, nice to have you on with us, Jocelyn. One of my clients have a follow-up reset for a year, okay? I find amazing results. She lost 25 pounds, but now the scale's going up. Okay. Her abdomen is growing still, following the reset and doing strength training with me 4 times a week. She is growing muscle at 71 years old, and that's amazing. Yeah, it is, and it's good for her. Yeah, you're doing the right thing there, by the way, Jocelyn, because muscle, and we talk about this all the time, okay? What I know today about muscle compared to what I used to know, like I studied muscle, big time. But we never knew metabolically how good it was for you. We never knew metabolically how it was really a lifeline. We never knew that. I always said, okay, because I've always said this for 50 years, that osteoporosis was usually a lack of muscle. Okay? But what we know today is that they're bins, they're insulin. They're so good for metabolic syndrome. They save your bacon when it comes to your lifespan. And the research is overwhelming, so good for her, okay? Look, as far as she's not losing fat anymore, is that really, she has 2 bald spots in her hair. She takes your protein shakes in the morning, good for her. Takes your supplements. B12, her levels are optimized. Her vitamin D was high, so what? And she stopped taking the supplements for vitamin D in the summer, getting out in the sun. Okay, that's all right. I'm just trying to think. Look, she might, I'm never one on calories, never have been. But she might just cut back a little bit with the protein shakes and that. Like just eat, because it really isn't calories, but she might be just, if she, like it depends what your goals are. If she's building muscle, hallelujah. Now, belly fat, always check Joss for cortisol, because that could be giving her that. Okay? Very specifically, belly fat, if she's getting strong everywhere else. But you might get her to cut back on the shakes a little wee bit, just to see if that helps. But boy, she's on the right track. At 71 years old. She's a puppy, by the way. Marie, let me see. How many more do we got? Okay, I ain't getting done this morning. Okay. Let me do one more. Marie's asking, what can I do to reduce liver enzymes? My blood tests are high for enzymes. Normal is 36. My results are 46. Yeah. I mostly do EMC. Well, you're doing the right thing to empty your liver. I do the reset again if your liver enzymes were high. Marie, okay? Like you might want to do the reset again, empty that liver. Like if you mostly do EMC and you're concerned about it, those are not extremely high numbers either. I'm not your physician, but that wouldn't concern me too much. And, there's a lot of other questions I'd ask you. Like, are you taking any pain medications or Tylenol or whatever? Because that sometimes can be a factor in that. I'd have to ask you some questions about that. If you want to give me more information, send it at info@martinclinic.com. Okay. Patricia's asking, what is the connection between she lost 30 pounds while in Italy? Holy smokes. Most people, Patricia, go to Italy and they gain weight. They're eating so much pasta. No, listen, I'm married an Italian. Okay? See how smart I am? I'm married an Italian. Yeah, like you're talking about, like, I lost 30 pounds while away. That's a lot of weight. Patricia, just make sure you're getting yourself checked out, get all the blood tests done. Can stress do that? Yeah, stress can be a big factor, like very high cortisol, in weight loss. What's your appetite like? See, I have to ask you a lot of questions to get more detail, that I can be more specific and give you better direction. So, you know what, Patricia? You too. Send me more info. But it could be stress related. But that's a lot of weight, 30 pounds. Okay? That's a lot of weight to lose. Especially if you didn't need to lose that. Okay? That's a lot of weight. You got to give me that information. Okay. Guys, I guess we're going to have Q&A Monday, and we are going to have it on Monday. Labor Day. Okay? Labor Day. We're going to have it. Okay? Lord willing. I have to say that, because you never know. Right? Okay, you guys are fantastic. Thanks for sending in all the questions. We appreciate that. We love you guys. You have a great weekend. And if you can, on holiday Monday, back again. Talk to you soon.